Hello and welcome to this report on the state of the U.S. dental economy for Q2 2025. This is a new report coming from the ADA Health Policy Institute. My name is Marko Vujicic. I'm the Chief Economist at the American Dental Association and the head of the Health Policy Institute. This is a new report coming from the ADA where we are combining several different data sources. You can get all that information in the slide deck, a lot of details on methods and data sources. I won't go in that here, but we're combining proprietary data collected by the Health Policy Institute with various other data sources coming from government databases as well as other areas. Let's first look at a key indicator we monitor, dentists' economic confidence. The punchline here is that dentists' confidence in the overall economy took a dive in Q2 of 2025 and is down significantly from the beginning of the year. Particularly, dentists' confidence in the dental sector overall, as well as their particular practice, saw declines as well. And importantly, both are at new lows. So clearly, since the beginning of the year, we've now had 2 consecutive quarters of pretty significant declining economic sentiment among dentists in the U.S. Of course, there is a general decline in consumer confidence in U.S. households, so this is not necessarily unique to the dental sector, but is obviously very important. We did significant analysis on what is driving dentist sentiments, and here on the screen, again, you could look more detail in the report. But generally, the top reasons driving skepticism, and again, more dentists are skeptical than they are confident. And among those that are skeptical, you see the top 5 reasons there. The current administration's policies, tariff concerns, costs and inflation, uncertainty, geopolitical, and war turmoil. Interestingly, among those that indicated they were confident, and again, that's fewer that said they were confident than are skeptical. So the majority are skeptical. But among the minority that are not skeptical and are confident, it's interesting that the top 5 reasons they give are very similar. So this is one of these characteristics where people see kind of different opinions on the same factors in play in the U.S. economy and in larger policy. We also track what dentists are planning to do and what they're doing in terms of key areas of investment and, for example, participation in insurance networks. On the left side of this screen are data from the end of last year, from the end of 2024, where we asked dentists about their intentions in 2025 to add staff, to drop out of insurance networks, to make major equipment purchases, and to invest in new software. These are some barometers of investment sentiment. And obviously the second one is an important one we're tracking, as you'll see in a minute. A lot of factors in play in terms of insurance, reimbursement, etc. But if we compare the plans on the left with behaviors so far in 2025 through Q2 on the right, we're generally calling this dentist sticking with their plans. So despite pretty heavy skepticism and a decline in overall confidence, we're not seeing major pullbacks in, for example, making new equipment purchases or investing in new software. Again, the right side is through the first half of 2025, so there's still some runway to go. But again, we're saying dentists are kind of holding steady in terms of their plans. Second area we look at is completely flip side. We're looking at data on consumer dental spending. And these data are through May 2025. And our punchline here is that so far this year, well, through May, consumer dental spending is up 3% from the beginning of the year. And you can see some of the other statistics there on the right. Pretty important. So it's not that spending is contracting among households in the U.S. It's not growing gangbuster, but at least through May, it's up, and it's up 3%. And again, we put this in context of statistics related to spending in healthcare overall by households and in physician services. So again, if you look at the green line, this is the barometer of consumer dental spending. And in this case, we've set that at 100 pre-pandemic. So for example, if you go back here, consumer dental spending is up 8% compared to pre-pandemic. In this chart, that shows up as 108 versus 100. And if you compare that to physician services and healthcare spending overall, we do see that dental spending lags healthcare spending. So while dental spending among households is growing, it's growing much slower than other areas of healthcare spending. Third area we look into is a deep dive into dental practice economics. And let's show some of those data. In terms of dentist busyness, a very important indicator we track, no big change. That's the punchline. So if you look at the last few quarters, especially Q2 compared to Q1, no big change. So what is this telling us? Well, telling us that the 3% increase in consumer dental spending since the beginning of the year does not seem to be translating into any sort of major increase in busyness levels in dental offices, which is telling us that this 3% increase in spending is kind of easily absorbed into the capacity. And as I mentioned, it's not like a gangbuster growth rate. Similarly, we track wait times for patients, another really important barometer of busyness activity. Again, when wait times go up, it's an indicator of much more busyness, tougher for patients to get in, or limited capacity. When wait times go down, it means slack in capacity is opening up in the system, and dentists aren't as busy. But no big changes here. You can look at the data, but again, punchline here is, again, we're not seeing any sort of increase in wait times due to the consumer dental spending growth, which is telling us kind of things are stable or flat from the perspective of economic activity in dental offices. Okay, next couple slides. We're going to dive into the supply or the expense and revenue side. One thing we track is price levels for equipment and supplies. And the punchline here is those are increasing, particularly since the beginning of this year. So you see that burgundy line, that's an index of prices for dental equipment and supplies, and you see pretty big spikes there. So we are seeing actually through Q2 a 5% increase. So for the first half of the year, and again, this is all inflation adjusted, there's a pretty big increase, a 5% increase in prices, according to these data. We match those data with triangulation again. This is self-reported. So the data I showed you here comes from very robust quantitative data sources. This is more self-reported, but we asked dental offices in our last polling what they have seen so far in terms of price increases since the beginning of 2025. Again, you can look at these data, but the punchline is at the bottom. The self-reported data paint a similar picture as the data from other sources, what I just showed you. And again, looking ahead, dentists are experiencing or expecting price increases to continue. You can see here kind of most expected in the 1% to 5% range for the rest of this year. So definitely we've seen price increases, and dental practices continue to expect prices to increase for the remaining of this year further. The flip side is reimbursement. And here we're tracking a few indicators measuring payment rates from public insurers, private insurers, and overall combining all that. They're all painting the same picture, and that is that reimbursement rates are not keeping up with inflation. So again, while we see the cost side, price increases rising pretty significantly, on the revenue side of the equation, Reimbursement rates have been quite stagnant. They are rising, but they're rising slower than the inflation rate. So really important, these trends combined in this section show that there's a fiscal squeeze on dental practices, as we call it. So the data continue to reinforce that is happening. Last section we look at is the job market. So just for context, these data are for the overall U.S. economy through June, and it's pretty clear there. The overall economy continues to add jobs each month. When we look at these equivalent data for the dental sector, so these are job counts for total employment, let's say, unlike the U.S. economy overall, the dental sector is not seeing growth in the total number of jobs in recent months. So even for the past year, if you go all the way to bottom right, we basically have had flat job numbers in the dental sector. Very, very negligible increases from a year ago, from January of this year, and for this month, it's slightly down. So really important here, employment is flat to slightly down, if you want to squint and look at that, while the overall economy continues to add jobs. At the same time, it's still really hard to find staff among practices that are recruiting. We continue to see really, really high numbers of practices reporting that it's very or extremely challenging. That's what we're showing here. So for example, in Q2, 91.7% of practices that are recruiting hygienists indicate it's very or extremely hard. So we still see a pretty tight job market in terms of recruiting hygienists and assistants as well. Although as you see there for assistants year over year, there has been a little bit of relief. But again, these are all extremely high numbers. So recruiting is pretty difficult. An interesting trend we've uncovered that we've not reported before, that have not seen before in the data, is there is a slight downward trend in hours worked. So if you look at dental staff in offices and you look at average hours worked per week, which is what this is measuring, we have seen kind of a slight decline in hours worked on average in offices. And again, we don't have a strong explanation of that. Again, consumer spending is growing slightly, but it's growing. The wait times are flat. The busyness levels are flat. Recruiting is still difficult. So you could make a case we may, according to that, should have seen hours be flat or even slightly up, but they're slightly declining, which is interesting. We'll keep tracking this. And so let's zoom out. So in terms of key takeaways at the highest level, there's 4 of them. So first, in Q2 2025, economic confidence among U.S. dentists has declined. This is the second consecutive quarter of decline after a significant surge in Q4 of last year. Economic confidence for dentists' own practices, as well as the dental sector overall, has hit a new low. And the top 3 factors cited among the skeptical dentists is current administration, tariffs, and inflation. Dentists' declining economic confidence mirrors trends among the general population. Big key takeaway number 2, consumer dental spending continues to increase, but slowly. Spending on dental care is up 3% since the beginning of the year and 8% since, 5 years, right? The COVID pandemic. And spending in dental care lags overall health spending, and that's important. And the big one is the growth in dental spending does not seem to be having any big impact on dentists' economic confidence, and it seems to be easily accommodated within the existing capacity in the system. Busyness levels, appointment wait times are largely unchanged. Key takeaway number 3, reimbursement rates for dental care services are not keeping up with inflation. At the same time, prices for dental equipment and supplies, as well as wages of staff, are tracking with or even rising faster than inflation. So this continues to place a fiscal squeeze on dental practices. As a result, about 1 in 4 dentists have reported dropping out of some dental insurance networks. Conclusion number 4. Job growth in dental offices has been stagnant for several months, even as the U.S. economy continues to add jobs. This could be explained by significant difficulties dental offices report in recruiting, or it could reflect increased hesitation in hiring due to more pessimistic economic sentiment. We're not sure which of these factors is dominant. And as I mentioned, average hours worked per week in dental offices by staff is also on a downward trend. So if we were to sum this all up in a couple of paragraphs, this is what this means for where we are today in Q2. So the data from Q2 show a clear downturn in dentist economic confidence driven by concerns about the current administration's policies, including tariffs, as well as long-standing concerns over inflation. Other data sources suggest pricing concerns are valid, as prices for dental equipment and supplies, as well as wages, are rising faster than dental reimbursement rates. The resulting fiscal squeeze is certainly one factor that could be driving down dentists' economic confidence. On the consumer side, dental spending continues to increase modestly, but the latest data show that this is easily accommodated within the existing capacity in the system. Dentist busyness levels and patient wait times remain largely unchanged. In fact, average weekly hours worked in dental offices is down slightly this year. So taken together, the data through Q2 2025 overall suggests the dental economy is in a holding pattern with the potential for slight headwinds in the coming months. That's all for this quarter. Stay tuned. This new and improved report will be coming out for Q3 and Q4, so stay tuned for that. This is where you can locate us. And all for now from the ADA Health Policy Institute. Thank you for joining us.